take on from here.
Thank you. As you can see, I was trying to multitask so that we can live stream it to YouTube and we can record it from there. Let me just share my screen. Okay, hope everyone can see my screen.
Yes, we can.
Yeah.
Perfecto. Okay, my name is Linda Bello. As you guys know, I'm the chairperson. I'm also a salary GP at Colchester Medical Practice. I'm also a private GP for Bupa, or a portfolio GP. And that lovely picture there is the first hospital I ever worked in, which is UCL Hospital on Euston Road there. So a bit about my background before I start to give you a little bit of my tips about what I wish I knew. That lovely building at the back there is the UCL, which is where I did my training. So when I first went to medical school in 2000, um, I went to University College London, and then that year they merged us with the Royal Free, so we became known as the Royal Free and University College Medical School. Um, and I did my foundation jobs when I qualified at that lovely building I just showed you, University College Hospital. And then I started on the ACCS pathway, which is the acute care common STEM pathway. And I wanted to be an anesthetist, but I also enjoyed doing A&E, ITU, acute medicine, and the ACCS common STEM gave you that opportunity to do all of those. I always thought I'm gonna be a hospital doctor. I'm good. I like the adrenaline. I like to do all of this stuff. And when I did my ACCS, my ST1, first A&E job was at the Royal London Hospital, which is a major trauma center in London. And basically, I thought that that's it. I found my calling. This is everything I want to do, and I really enjoyed my time. But as we all know, things come in. Life happens, and I had to switch to GP training. We'll talk about that later. And I did I did that in Plymouth. So by this time, I'd left London and got to Plymouth because of some other challenges, which I will tell you in my presentation. And I completed my GP training in 2016, and I started some salary jobs in London, and I moved to Colchester 3 years ago. So I'm still there now. So what are my tips? What are my top tips? So it will be like I'm teaching people to suck eggs, but the main thing is really we're telling you things that you think that you know, but you know them, but obviously just putting them into practice, because that really helps us become the best and do the best that we can as doctors. So my top tip is always introduce yourself. And there was this geriatrician, this doctor called Dr. Granger, and she had this campaign about, hello, my name is, unfortunately, she was diagnosed with cancer in 2011, and she started this Hello, My Name Is campaign, in which she was encouraging healthcare staff to introduce themselves to patients. Why was she doing that? Because she was shocked at how few staff members introduced themselves to her while they were treating her. So, so don't rely on just having a name badge or just feeling, oh, I've seen this patient every day. They know who I am. Just introduce yourself. As a GP in my practice, of course, I call my patients in. They know they're coming to see me. But when they enter my room, I always greet them. I say, good afternoon, good morning. Are you so, so, and so? How may I help you? It always sets the scene, I find, and it always, I think, makes the patient feel a lot relaxed and things like that. So, I've never ever the patient comes in and I just say, what can I do? Or tell me, So that's my standard spiel over the 20 years plus that I've been a doctor. Um, and also on the telephone, I'll always start with, when I'm doing my private work, hello, I'm Dr. Bello from Bupa, and things like that. So really important. obviously medicine is a continuous learning process. So you have to read, you have to learn, it doesn't stop. I'm sure we all know this, doesn't stop when we finished medical school and we become a doctor. So especially as a junior doctor, you're going to see so many things every day. And if you see something you haven't heard of before, have a quick read about it. We're so lucky. You don't have to, you guys, you don't have to go to the library to be looking for stuff. We didn't have smartphones when I was training to be a doctor. Now someone can say something, you just flick it through your smartphone, look at BNF, look at NICE. There's no reason for you not to check things and be up to date. If you're a surgeon and you want to, or you're just going to assist in an operation, read about what the operation is going to be. Even if you don't want to be a surgeon, at least you make the best use of your time. It helps you understand what's going on. You can ask the surgeon a question. You can make him, even if you don't want to be a surgeon, make him feel like you really appreciate what he's doing. You love his job. And that always makes people happy. And then they can give you feedback at the end as well. And you never know when you might need that information. I find that a lot of things that I learned in rotations that I knew that I wasn't going to do still come handy for me till today. So, as I said, ours is a continuous learning, evolving nature of medical knowledge. So, how do you keep up? Some of us get journals all the time, attend conferences. And look, we've made it very easy for you here at CamDoc, courtesy of the education committee headed by Uncle Va. We have journal clubs every couple of weeks. Come and learn something different and put that in your portfolio and things like that. Organizational skills, yeah, really, really important that you're organized. Turn up on time, turn up before the time, you know. Um, Read up on your patients. I mean, I don't know if any of you watch Only Fools and Horses, but there's the granddad there who always says during the war, and I was about to say in my day, but I don't think I'm that old. But when I was an F1, my first job was a respiratory job, and we had a very strict professor. He was a professor of respiratory medicine, and his name was Professor Spiro. I mean, what a good name for a respiratory consultant. And he told us that we had to know about all the patients before he came on the ward round. So I used to have to turn up 1 hour early to read up on the patients beforehand that had come from A&E. And we do a pre ward round before the ward round where we would present all the patients, and you had to kind of do that from kind of memory. So I would say that although that was a very difficult period for me, it was a real baptism of fire. The rest of my rotations were very easy for me because I had that work ethos of turning up on time, knowing about my patient, knowing why they came in and things like that. So it's really important to do that. Patient records, make sure that what you write is legible and accurate. Again, another anecdotal story where, I used to have to write most of the ward round notes because my writing was the most legible, and the nurses used to practically beg me to write the notes. But yeah, try to make sure they're accurate and legible. Make your plans, share the jobs, and prioritize. Of course, I remember working on the wards. You might not finish all your jobs for the day, but obviously, if you prioritize the ones that need to be done, then you'll be able to get through it. And this is a big one for me, and I think for all of us as well, about really keeping an open mind, really about things. So for our patients, we need to be open to the fact that they may have a reason for turning off late to your clinic, or not attending, or not understanding you, or having different views to you. But one of the best things about our profession is that we get to meet lots of people, at least I do, from all walks of life and every background. And so we just need to know that, our job is that we're the professionals here, and we should not always take things, we should give people the benefit of the doubt. I work in a I wouldn't say very deprived, but I work in a town surgery, and we have lots of drug addicts. lots of people that have come, asylum seekers and things. And initially, when some of them come in, you might think, I don't, this person, you might subconsciously have a judgmental attitude. But, I find that when I've just given these people a chance, if you hear some of the stories, you know that sometimes they've ended up like that, not because of their own fault, but just because of how they were brought up, and sort of poor life choices, and sometimes the kindness that we give them actually can help people turn the corner. For yourself, I think as a doctor, junior doctor, not knowing what you're going to do, just be open about what you might experience, because it might not be as bad as you think it will when you go in. So I already thought that I was definitely going to be a hospital doctor when I started the job, but every single job that I went to, I pretended that this was the job that was going to be. So even well, actually, when I did colorectal surgery, that was the one job that I thought, I don't know if I want to be a colorectal surgeon, because, I didn't really like the surgery so much. But I still tried to learn about it. I went to theatre, I asked the consultants questions, because, as I said, one day you might just stumble in your passion in medicine. And as I said, till today, I still use some of the things that I learned in certain specialties that I didn't think that I would need. So definitely use every rotation as, I might want to become this, just do your best in that rotation. Don't just say, I'm not going to go to theatre because I'm not going to be a surgeon. You never know what you might learn. Um, Right. And then you're planning plan your life, not just your career, right? And I was telling you in the beginning about how I started off doing my ACCS, and I was thinking, oh, I'm gonna be a hospital doctor. I'm gonna be adrenalized every day because that's the kind of thing I like. And of course, life comes in. So, work-life balance is not just about sort of your family and your children and things, but it's also about your hobbies, having friends, sleep-ins, and being as fit and healthy as you can, and sleeping well so that you can do your job. Having your friends around you, a support system. I believe that here at CamdocUK UK we have some a good support system, especially in our family group, so that you can have people to have fun with, and debrief as well, so that you're happy, because when you're happy, you can obviously do your job better. So try and maintain like a human connection. So what I'm saying is, try and prioritize your well-being, strategize so that you take regular breaks. No one's going to give you a medal for working without having a break. No one. I know, yes, you might leave earlier, but it's just better if you try and take some time off. Personally, during the year, as a GP, they make us take our leave a year in advance. So right now, I already know the leave I have next year, and I always make it a point that every 6 to 7 weeks that I've taken some time off, because I find that after about 2 months or so, I'm already getting a little bit burnt out. So it's really important to plan things, and then I obviously have things to look forward to. But at the same time, I know we're doctors, right? So we have to plan our careers. So once you've worked out what you want to do, then talk to senior doctors, registrars and consultants. What are the things that will be beneficial for career in surgery, career as an anesthetist, career as a gastroenterologist? And then you might want to get involved in some research or do the courses that are offered by hospitals or other colleges. But then don't forget about clinical work, because of course, all the research in the world is not going to replace good clinical skills, whether so going to the theatre, cath lab, or anything like that. And besides finding a specialty that you enjoy, so for me, I really enjoyed acute medicine. I like being ITU. I like anesthetics, but I had to be pragmatic in the end because, for me, it was about family. At the time, my husband was a surgeon as well, and both of us leaving the house early and having two young children. I had to be pragmatic about that, which is why in the end I became a GP. We also know that there are certain specialties that are more difficult to get into, or Hello? I think there was a bit of a crash. Can everyone still hear me?
We can
I
hear
can
you.
hear you.
Yeah,
Yeah,
perfect. Yeah, it seemed it crashed, so I'm going to reshare my screen. Okay, can you see that?
Yep.
Perfect. Yeah. So as I was saying, just making sure that when you pick the specialty, also pick one where you know that you're going to be able to get your number easily. So for instance, the reason I ended up in Plymouth was because my husband wanted to do cardiothoracic surgeon. There was no stopping him. And at the time that he applied for it, there was only 10 numbers in the UK and he managed to get one in Plymouth. So we had to go to Plymouth. So just be mindful about what you're choosing and you know where it might take you. All right. So asking for help. You should ask for help and ask early. So as a junior doctor, it's really easy to think, oh, I need to know this. Everyone thinks I'm going to know this. And if I ask it, it means I'm stupid or something. Simply not the case. If you're in over your head, just ask for help. There's so many resources available, nursing staff, other healthcare professionals, or just even your body. So when I was doing my respiratory job, I had I had a buddy, you know, we were doing the same days, and you know, they called me once to the clinic to come and do a blood gas. And I'd done a total of one blood gas in my life. And I was scared. And I went and asked my buddy and I said, you know, I've been asked to do this blood gas, can you do it? And she was like, I've done two, so I think maybe we should both go and do it. And we went and we read up again about it, and then we figured it out. Poor patient, but it was only after two attempts. And we're also, some of us are in lucky situations that we have older sisters, older brothers, or CamdocUK family. You know, always feel free to ask any of us. Some of us work in the same hospitals as some of the senior doctors on here. So always don't be afraid to ask, and ask someone more senior because they'll help you, and you'll also learn something. In my experience, the doctors that have worried me or caused issues are the ones that don't realize their own limitation and just struggle on stubbornly. So please don't be that doctor. Honesty, honesty, honesty is the best policy. Don't try to lie. You're gonna get found out, especially if you're lying about a patient, lying about results. If someone's asked you for blood results you don't know, don't lie about it. Just say, you don't know, you're gonna find out. It's much more professional and it's safe. Likewise with our patients, if they ask you something and you don't know, as you can imagine, as a GP, I have many people coming and asking me, Doctor, do you know about this fancy new drug? Do you know about this condition? And I always say to them, and I say, no, I've not heard about that. I'll find out about it. Or
You don't need any more storage.
I'll
Can I
ask,
have that one?
or I'm gonna ask,
And
I'll ask.
can you mute yourself?
I've muted her myself. Can we ask a colleague? Sorry, let me go back. Yeah, so I'll say, can I ask a colleague? Or, you know, so in this day and age, everyone knows that we can't know everything, and they actually respect you more if you say, listen, I don't know, and I'm gonna check, or it's something that, you know, I haven't heard about, or the guidelines have changed, or I need to check the guidance. And I commonly do that in surgery if there's something, and I say, listen, I'm just checking to make sure. Even when I prescribe, I'm just checking to make sure because I have to be sure of the dose and things like that. And you find that it's so easy for you, and it becomes part of your practice. I did a presentation here a few months ago on an unusual case that I picked up. You know, it was a rheumatological case. The case was on eosinophilic fasciitis. When my patient first came, I had no clue what was going on, but we worked together. And I said to him, listen, I don't know what's going on. He said, oh, I'm going to go and find out. And we did, it was a team effort. And, you know, medicine is no longer paternalistic. And right now we need to be, it's always about working with the patients, and, you know, and sometimes the patient will know something that we don't know. So really important, honesty, honesty, work with the patient. talking to patients, my favorite. Obviously, as a GP, we have to talk. A lot of patients want to talk to us all the time. When you're on the wards, the patients want to talk to you, the relatives want to talk to you. But as a junior, if you do have time, you should read. There's nothing better than going and sitting with the patient and getting more of a history. Sometimes they've been clocked in A&E. Maybe the A&E doctor hasn't clocked in properly. You might get more history. You know, it's always very useful. You know, we don't always have time to sit down and talk to the patients, but if you do or you don't have time, obviously say to them that you come back when you do. Always make sure that, you know, the language barrier is addressed. You know, for us at the surgery, we have our language line. It's just there at the tip of our fingers. And there's no reason why patients shouldn't understand you and you shouldn't understand them. Don't also forget the patients who are deaf. And finally, enjoy yourself. I mean, I think it won't be a cliche for me to say that I love being a doctor. I've always wanted to be a doctor from the time I was little. When I got into medical school, that was the happiest day of my life. And till today, I really enjoy being a doctor. Why do I enjoy being a doctor? Because it gives me the opportunity to help people. It's cliche, but I really enjoy my job. And that's what really helps me through all the difficulties or any stresses or anything, because I feel that we're extremely privileged to be in the job that we are. We have great opportunity. So as a junior now, you have a great opportunity to have a stimulating and fulfilling career, and you will get the chance to meet some amazing people, see some incredible things, and look after your patients. But most importantly, look after yourselves. You know, if you're ill, don't turn up and be working when you're ill. You know, no one's going to give you a medal for that. You know, make sure you're well enough to work. And if you do look after yourself, mostly the rest of it will fall into place. Thank you very much. And I'm leaving you with a picture of the cruciform building. I used to walk into that building every day, go into the right there, spent some nice 6 years in learning and studying to become a doctor there. So thank you very much. And I'll be happy to take any questions.
Wow, thank you so much, Dr. Bello. That was quite, yeah, very interesting, isn't it? And I'm so happy when you started talking with what you learned from Kate Granger, because she's taught us a lot of things in the UK. Ironically, I was a registrar with her.
Oh, wow.
Yeah, working in the same hospital. And when she was diagnosed, we were working the same deanery. And then I worked with her on the same ward. And you're right, her story was she got, I think, 3 books, and she very, very interesting to read. But there was something she changed in me. She said to me, you don't understand how, when a patient is lying down and you're standing over them, how overpowering that can be, how it makes them feel very vulnerable. So I always now try to go down to the patient's level when I'm talking to them, rather than talking over them. It's some of the little tricks of patient care. And you're right, knowing your patient is extremely very important, isn't it? Particularly nowadays when our patients have many comorbidities coming to hospital. And I found out that most of the consultants who supported me are the ones who felt like I took time to know who my patients were. Is there anybody who wants to make a comment or ask a question to what Dr. Bello has just said? Yes, no? Right, okay. Well, was that somebody talking?
That
Yeah.
was regular.
Yes.
Hello.
Hello.
Yeah, we can hear you.
Yes. Thank you so much for the wonderful presentation. It's quite lovely. I just want to say I'm currently in Plymouth, so I had to spend some time here. What are the fun things one could do in Plymouth when they're off?
You ask? You're in Plymouth. Are you working at Derriford Hospital?
Yes.
I remember it well. Well,
Oh.
I left Plymouth in 2016,
Oh.
and it was very boring. when I was there. The best things to do there, are the access to the beach, right? I used
Yeah,
to go to many beaches there. Cornwall is just down the road from you. When I say down the road, depends on which bit of Cornwall you
yeah.
want to go to.
Okay.
The moors, if you like walking.
Yeah.
Um, but when I was there, I remember there was only one mall
Oh,
in the center. I'm sure it's got better, right?
yeah. Yeah, there are quite a few malls now. Yeah.
Therefore, yes, we only had one more when
Oh,
we were there.
oh,
But yeah, the main thing I enjoyed, it was really good for the kids. Lots of beaches, lots of places to walk around, go on the
mhm.
moors. So that's
Okay.
what I that's what I remember Plymouth for, and being easy access to going to Cornwall.
Oh,
That's
okay. All right. Thank you.
and he has the best BTS training. If anyone ever wanted to become a GP, I think our VTS scheme had like 100% pass rate.
Wow.
Yeah, yes.
Wow. Thank you very much.
Yeah. Right now, what specialty are you in, if I may ask?
I am external law in oncology.
Oh, yes. Yes. I remember you said, yes. Good. How are you finding your workload and everything? Is it okay?
Well, it's first 3 months, the first few weeks were really confusing, but I'm beginning to find my feet now. The workload wise, I think it's okay. Yeah, we're well staffed on the ward.
Good.
Yeah.
Yeah.
Perfect.
Well, all the best.
Thank you. Thank you.
Um, Now, Dr. Yuk is our next person to tell us what we need to know, what he wish he knew when he was a junior, and so we can get from there. As we know, Johnny, as a popular call him, is an endocrinology consultant in Birmingham, and he's also one of the people in the management side of leadership. You're director of what? If you can remind me, Johnny, I know you're one of those big boys in the trust headquarters. So we'll be getting both the academic side, the clinical side, and the managerial side. The floor is yours.
Okay, thank you, Vali. So, for those who don't know me, like Vali said, my name is John Ayuk. I'm a consultant endocrinologist at University Hospital Birmingham, the Queen Elizabeth Hospital, and I have a few other roles as well. I'm postgraduate clinical tutor at the Queen Elizabeth Hospital for the medical specialties, and I'm also now I mean, the role Vali was talking about was I was previously deputy medical director for one of the divisions in our hospital. Now I've moved on to associate medical director for trainee support and well-being. So it's probably worthwhile I just tell you a little bit about my journey, like Linda did. Although, for a lot of the things I was going to tell you, Linda's covered in her talk. So yeah, all through medical school, I was always going to be a surgeon. It was 100%. There was never anything. I didn't know what sort of surgeon, but I was going to be a surgeon. And then I finished medical school and I was doing my surgical house job, so the equivalent of F1 jobs now, in Wolverhampton. And I kid you not, that sort of made me decide I would never ever want to do surgery. The reason being, and no disrespect to any of our surgeons here, the surgeons I worked with then, it was just very obvious they were not, certainly the ones on the ward I worked with, it was a vascular ward, they were not particularly interested in patients. And, Linda said very clearly, and I think Val also said that, what we do, we're doing for patients. They are we do all the other bits on the side, but actually what it comes down to is what we do for patients. And, a patient holding your hand and saying thank you gives you more satisfaction than any presentation you do in front of any audience or any paper you publish. And I thought, I don't want to do this. And at that time, I remember the people I most admired were the medical registrars, because whenever anyone was in trouble, whenever anything happened, if it doesn't matter what, if there was a shortage of food in the canteen, they would say, call the med reg. If the hospital was on fire, call the med reg. And I'd look at them and I think, I want to be like you one day. And so I decided to do medicine. So did a couple of years as a medical senior house officer. And after I got my membership exam, I decided I wanted to go into a specialty which still gave you a very good grasp, or allowed you to have a very good grasp of general medicine. And that's how I ended up in endocrinology. Now, what did I do? At that point, the consultant I was working with was an endocrinologist, and he put me in, this was actually his first consultant job. He just finished, just qualified as a consultant, and he put me in touch with a professor he had worked with. And this professor had a project which he wanted someone to do. And so what arrangement did we make? In the end, what I would do was, I was working in a different hospital. This consultant was based at the Queen Elizabeth Hospital. I was based in Solihull. But what I would do was I would go to work, come back, have dinner, and then I would go to the Queen Elizabeth Hospital. So what we're doing at the time, we were gathering data on some patients, on this condition called acromegaly, which I'm sure you all know about. Okay, so don't think it's like now where you have electronic patient records, and if you want to look back at the patient's information, you log in and you just sort of sit there on the computer. Nope. I would sit there with piles of dusty paper notes next to me, going, and for each patient, I will have to go through the notes, look for where the results are, where all the information was, and put that in an Excel spreadsheet. And so I did that. And as it happened, there was a conference coming up, and he told me, oh, look, we've done some good work here. Why don't you submit an abstract? So I submitted an abstract to that. And believe it or not, this was my first foray into proper endocrinology. I got an oral talk at a conference in Sydney, Australia. That was my first conference I'd ever been to. I'd not even been to a local conference in Birmingham or a national conference. My first conference ever was in Sydney, Australia. What then happened was a sort of clinical research fellow post came up in this hospital, and obviously this guy shoehorned me into that role. And that's where things took off. So this guy stayed, he's stayed my mentor throughout my career. And again, it was just because, I suppose, he thought this guy works, he's willing to make a sacrifice, he works hard, so I'll give him a chance. And the reason I tell that story is because I want to come back to what Val said earlier on, when he sent in his CV to someone, and the reason his CV was picked out amongst those hundreds of other CVs was because in it, he mentioned he was Cameroonian. And somebody who had worked with Dr. Nsutabu had been left with that impression of what a Cameroonian is. And so one thing I would always say to everyone is, when you're out there, put your best foot forward, because it will benefit you, because people will sort of always be willing to help you and to come to you for help. But also, you don't know what you're doing for the next person who comes in behind you. So, I now have Vicky who works in my hospital. And Vicky says, the minute she got in, the minute they heard she was Cameroonian, they asked her, have you met John? And obviously Vicky and I are now very good friends. But yeah, so it's always good to put your first foot forward, because it means people like you, it means people are willing to help you. And it also means people are willing to stand by you. And I'll talk a little bit about that a bit later. Anyway, so yeah, those are just a few anecdotes just to sort of set the tone for what I'm going to say. And most of it, Linda said already. Okay. There are a few things. One, make sure you enjoy the journey. Medicine's hard. Medicine can be very grueling. So you have to try and enjoy it. And how do you achieve that? One, it's by, like Linda said, going into everything with an open mind. Don't go into anything thinking, I don't want to be doing this, because it will show, it will be reflected in the service you provide, the care you provide, the interaction, not just with patients, but with your colleagues. And it will get reflected back onto you, because when people think that's the sort of person you are, that's the way they behave with you. Linda mentioned, so there was that. Linda also mentioned you have to make time for yourself. You have to make sure you keep yourself healthy. That's at work and outside work. At work, always make sure you take your breaks, make sure you look after yourself, even if it as busy as it is. You should always be able to take time to take a break. And if you talk to your colleagues, between you will always arrange it. Someone will always say, give me the bleep, you go, for 15 minutes and have a coffee or something. And when you come back, they'll say, you say, give me your bleep, you go off now. Always make sure you do that. Outside work as well, make sure you keep interests. Make sure you keep, people, your family, your friends, hobbies. You have to make sure you continue doing those, because those are what give you that balance, which keeps you sane. If you don't do that, you will find work starting to become a drag on you. And again, it will reflect in your performance. So always remember to do that. Now, one thing which can sometimes be quite tricky, especially when you come from abroad. I say this, I suppose Linda and I might have found this easier because, Linda went to medical school here, so she was going into the workplace with people who had gone through the same process as her. I was born and raised for part of my life in the UK. So again, I had that background of knowing some of the quirks of British people. Coming from abroad, it can be quite difficult. But what you'll find is most people are quite open. If you are open to them, they will be open to you. And you don't, if you find, and if you go in and you find, there's stuff people say and I don't understand and I don't understand the humor. Why was that funny? Ask people. People will tell you. And then you will start finding it funny as well. And then you become part of the crowd. You become part of the team. People view you as one of them. Now, Linda mentioned something about honesty. Honesty, it's crucial to be honest. And I'll tell you why. And these two things probably come together, being honest and being a part of the team, being someone who people think, they're hardworking, they're pleasant, they behave well towards other people, they behave well towards their patients. The reason is, if you think about doctors who, for example, get struck off the GMC register, or even who end up getting accused of manslaughter, you'll often find that the headline will say, this doctor made this mistake, this medical mistake, operated on someone and they died. But if you go to the background of that story, and okay, let me say one thing that is clear. Behind some of these things, you will always find, you will find racism. It exists. It's not that it doesn't exist. But behind many of these stories, when you don't know the background, you will find either that person had made that mistake and then had tried to cover it up by doing something, changing something in the notes or adding something to the notes or something like that. Or you will find that this is somebody who, when this problem happened, their colleagues would not back them up. And that would be because of the relationship this person had within their team before this happened. And that's one of the reasons why we often find people who come from abroad are more embroiled in these sorts of issues, because it's harder for them to be part of the team, because you've got a cohort of people who have known each other, grew up in similar circumstances, have similar jokes, and you're coming from the outside. But in general, if your behavior is viewed as positive and pleasant, you will always find that people will embrace you. So those are very important things. The honesty, the being part of a team. What else can I say? Never feel you need to struggle on your own. Never feel that. Nobody knows all the answers. You know, when I was a junior doctor, I used to think the consultant knows all the answers. And I'd feel really bad when if I got asked something and I didn't know the answer. What I know now as a consultant is we are always bouncing things off each other. Even now, as one of the more senior consultants in my department, I will sometimes take cases to our general meeting and say, guys, I want your ideas on this. And we do these meetings now in a way that, we have our trainees there, we have our nurses there. So the whole team is involved with these discussions. And so everybody, and because of that environment, nobody feels I'm expected to know everything. So when I ask my registrar a question, if they don't know the answer, they'll say, I don't know the answer. Because they know, last week they heard me asking my, other colleagues for the answer to something. So if I don't know all the answers, why would I expect them to know all the answers? So always be willing to ask. Don't do things and think, I'm embarrassed to ask, so I'm just going to do what I think is right. Because if you do that and something goes wrong, the first question will be, okay, so clearly you weren't sure of what to do. Did you ask? And there's always someone you can ask. There's always someone above you who you can ask. And if ever you ask someone and they do they do belittle you, or they do sort of make you feel that you shouldn't be asking questions, then certainly in hospital and even in GP line, we have people like, one of my roles as clinical tutor. Trainees come to me with that. If they feel that they're working in an environment where they're not able to ask questions because they're worried about the response they will get, then for us, that's a problem. My job as clinical tutor is making sure that we are providing a good learning environment for trainees. So never feel you have to struggle alone. Never feel you can't ask questions, because you can. And if anyone makes you feel you can't, then they are the problem. You're not the problem. And there are always channels through which you can escalate that. Thinking about if there's anything else. Okay, I'll leave it there for the moment. But I'm sure you guys will have questions or scenarios you might want to put to us. And there's, not just me, not just Linda, there's a few senior people on the call, Valley himself, Dr. Ngwa himself. Is Ostrich still there?
No, I am, yeah.
Yeah, Ostrich still there. Yeah. So, there's a wealth of experience on here. So please, anybody who's got anything to ask, be it hypothetical, be it something which is really happening, do ask.
Thanks so much, Johnny. That was brilliantly put. And just I took a few take-home points from there, and I think you buttressed leader's point, the one you said working hard pays, not just to you but to those who come after you as well. Absolutely. And one of the things I always love working in the UK is the people you work with, like the consultants, have an open mind. If they say you're playing yourself, they will really be with you, and they can open a lot of doors for you, or people who know you. And they'll stand by you. They are standing by you. I want to make one example here. As some of you will know, I used to be an oncology registrar, and when I go to clinic and we're consenting patients for chemo, I used to always print out on the Macmillan website, say I want to give Dr. Robucin or something. I had to go on that website and I print out the patient leaflet for the patient information for that particular chemo agent. Now, it always had effect. It will talk about, of course, neutropenic sepsis is something you worry about. It will talk about hypothermia, high fever. But as we know, in neutropenic sepsis, hypothermia is as bad as hypothermia, if not even worse. So I used to always, but that hypothermia is not there. So I used to write it with a pen. Now, one day I was passing through the chemo suite, and there was a patient who had had chemo a few days before, but had some pain and came into hospital. And the nurse said to me, "Oh, this lady is in pain. Can you sort her pain out for me?" So I came, and she was on Zomov and PLN Oramov. I just increased the dose of her pain analgesia. So I came to write on the note, and so the nurse said, "Oh, just leave me some gap, so I can come and put the ups there. Leave me some gap, then you write." So I went below and I wrote my plan and everything, what I did. That nurse came to the patient's ups, and the temperature was 35.2. And she wrote them down on top of, so if you look at it, you think that she wrote, then I wrote under. That patient went home. That evening, she became very poorly. She tried to call the chemo, nobody picked up. She went to bed. The daughter found her very unwell the next day. So brought her to hospital. And like, I don't understand this lady. My mother was here yesterday, and they went home, so they went to check the notes. They found out that temperature was 35.2. And that nurse said, "No, I saw that temperature." And I said, "No, she was, so I should give her some gap." No, she said, "No, I saw the temperature." That was her statement. Who stood by me? My consultant. He said, "I've seen Valentine always write hypothermia on those Macmillan forms. So there is just no way he would have seen that temperature and have gone." And that was what saved me on that period. So that was just to back your point. If you apply yourself, people will stand by you. And even when something happens, they could say, knowing who he is or who she is, this must have only happened by mistake, not the fact that it was negligence and stuff. So I really do agree with you on that. Is there anybody who wants to make a statement or ask a question?
I guess also, Vali, going back to your thing, never leave a gap for someone to write.
Since then, I was to cross.
Yes, big book cross
Since
there.
then, I used to. I learned a lesson. I learned a very, very big lesson then. Honestly, yeah. Because if something has happened, touch wood, nothing did happen to. Is touch wood something out of Yorkshire? Because with Yorkshire we say touch wood. Do you guys do it down anywhere else? Okay, I was scared. Yeah, but yeah, I learned a big lesson then, and I think I'm so thankful to my consultant because she was adamant. No, there's just no way I would have seen that and passed over it. I would have maybe kept that patient in and stuff like that. Yeah. Any question, any statement?
Can I just add something?
Yeah, sure.
Yeah, I mean, I think one has to be obviously always conscious of cultural differences and the impact that they play. Obviously many years ago when we arrived in the UK, having trained and done our house jobs in Nigeria, I worked in Cameroon. And my experience of seeing what happens here where I work in Doha now sometimes is that people from cultures where there's a lot of hierarchy have issues with sort of having discussions with their seniors or raising concerns that they have with their seniors. And this is a real problem sometimes in medicine. I say to the trainees and to one of my colleagues who's in quite a senior management position, I say the attitude that you guys take, one day you'll be making a mistake that's incredibly obvious. Everybody will see it and know that you're doing wrong, but no one will say anything. I mean, this is the classic example. If you've seen there's a video that talks about situational awareness training in medicine in the UK, all in a day's work or something, where you had senior people sort of tunnel vision and the staff in theater knew what needed to be done, but they didn't just raise it because they didn't have the language to do it. So always be aware that you're in medicine, you're dealing with life. And what's the worst that can happen if someone shouts at you? Ultimately, the shouting, okay, it's not very nice, but if you're concerned, you raise your concerns at the point, and they'll be grateful for it if you do that. I think ultimately, as seniors, I think one of the things I do in ward rounds, and I learned this from colleagues back in the day, is always ask the question on the ward round: is there anything else that I'm missing? And that gives everybody the opportunity to raise points. It's a kind of a nice way, because then Nobody feels like they are, pointing out my mistakes or whatever it is, but it's about covering all the bases. So the nurses are there, the midwives are there, and it's sometimes it'll be something pretty obvious that you've missed. Okay. And then going back to my early days in the UK, obviously in obstetrics is kind of rather different from a lot of specialties, in the sense that you have two different professional groups that are quite independent, and sort of can work separately. Always know that you can learn from your allied professional colleagues. Okay, your pharmacy colleagues, your nursing colleagues, your midwives. Some of them have been doing their job for 20 years. My first teachers were my midwives. And I always have a great relationship with midwives because I value their input, and I learned a lot of what I know at the beginning of my career from them. There's no way you would work as an obstetrician and have an easy life if the midwives are not on board with you or respect you. It's simple. So you need to sort of from some cultures, it's humbling yourself because some people come from cultures where you think a doctor is above other people. So you need to always be mindful of that. If you happen to have come from that kind of system, learn from whoever you can learn from. Your pharmacy colleagues know all the stuff that's relevant about medication. Your physios, your nursing or midwifery colleagues, they know what's going on. Your specialist nurses know what's going on in the ward. They will be great teachers. Humble yourself, ask them the questions. They'll enjoy teaching you. They know in a few years you'll be the consultant that they are working under. But they'll be delighted that they helped you in that process. The honesty thing, I think, again, we need to emphasize it. I always say to people, again, if we make up stories and we lie, it becomes clear. Okay, patients are not stupid, because the story is never the same. If we're all telling, if we're making stuff up and not being honest, I will say something different. Vali will come and see the same patient and say something slightly different. The story doesn't match up, and they will know. So that's why in the UK, for example, you have the concept of duty of candor, which is, again, having worked in the UK and now working somewhere else, I see the value of what you call the duty of candor. It is incredibly difficult to do. And again, in obstetrics, we happen to work in a field where, we have to break bad news sometimes in a really sort of awful situation sometimes. But that honesty from minute one means that the story stays the same and you build trust.
Yeah.
It's not often pleasant when you do it at the beginning. And thankfully, it's obviously mostly senior people that would need to do it. But it's important to be honest and stick to the facts. This saves you. It makes everything easier downstream. And Johnny highlighted the issues that can have with regards to integrity and losing your license. Losing your license can be for what people who consider quite mundane things. Okay, it could be obviously drink driving, for example. So there's lots of things that doctors have responsibilities and are treated slightly differently from the rest of the population. Most people will not lose their jobs because they drink drive and have an accident. Doctors sometimes will. So we are held to a different standard as doctors, and we just need to be aware of that. So those are a few of the things that I will add. If there's any, and on a personal level, keep your hobbies. Find a football team if you love sport. Support the Arsenal if you don't have a team. We're doing well now. We've gone through the pits. We're doing okay now. So leave that Chelsea business. Who's that?
Yeah, Chelsea. Leave Chelsea.
Leave that Chelsea business. You guys have 10 years to go through what we've gone through.
We're not.
So you think money is there again, huh? Okay. So and all the titles you won will be taken away from you. You and City. You and City.
Patrick is also saying
find a hobby and something that you really enjoy and have a good circle of friends. I think now we're even lucky because you can even have remote friendships, right? In the old days, you had to drive from Leicester down to London to meet your friends. You could only call them on their house phones before mobiles became. So it's much easier now. But keep your friends on side. Make time for them. Find a hobby, something that you enjoy that keeps you away from that stress of work, and share your sort of issues at work with that sort of trustworthy person in your life that can sort of help you with that burden. Okay, that's some of the pearls in my few years of doing this job.
Thank you so much. That's very useful.
Apart from the Arsenal bit.
Actually, Vali, can I just add one tip?
Yeah, sure.
There was something you said earlier on, which I was going to say something about when I talked, but I forgot. You mentioned the importance of looking, and I think, Linda, you mentioned as well, the importance of viewing our patients as people, not as a disease we're treating.
No.
So a tip which I learned, so I've not been, I've not had a ward now for many, many years, but when I did, a trick I learned of a consultant when I was a registrar, and which I always used to do without fail, was whenever I had especially an elderly patient on the ward, I will always tell the family, I want you to bring in a picture of this person when they were young, if possible, doing something which, and so, they would bring a picture of this, you see a 90-year-old man lying there who can't talk, can't move, and, juniors are coming and taking blood from him and all that. And they would bring a picture of him when he, with his cricket bat, when he was playing for Warwickshire Cricket Club, or they'll bring a picture of them in their army uniform when they were there. And it actually, you wouldn't believe how it just turns this person from a patient to a human being.
A human being, yeah.
And people start talking to them differently, start dealing with them differently. And that's for everyone, from the junior doctors to you yourself as the consultant, to the nurses. Everyone suddenly views them in a different light and thinks, actually, this person wasn't always an old person who just needs treatments in hospital. This person was once young like me, doing the things I'm doing. So it really helps humanize people. So that's a trick I learned, which I thought.
I think that's very brilliantly said. You're very right.
If I may add something. Can I add something?
Yes, Chief.
Okay. It was about the nurses. I think somebody brought it up. I think that was Austri talking about midwife. I think working with the nurses is really, really important. I was going to mention that. I mean, for the junior doctors going from one ward to another, and then having good relationship with the nurse would actually save them a lot.
Absolutely.
And that is something that I learned earlier on and so on. Because if the nurse is on your side, usually sometimes the consultant doesn't even actually know what you do. They go to the senior nurse, and then the senior nurse tells them what you're actually doing. And if you have a good rapport with them, you're always in the good books.
Yeah, true. Junior doctors need to also know, I'm coming to you in a minute. Junior doctors need to also know that they might be rotating through a department for 4 or 6 months, but that consultant and that sister are working together for years. So never pitch yourself like want to pitch doctor against nurses. Don't.
Yeah, they could be married.
Yeah, yes, don't ever. And if they want sister or they want nurses, say something you don't like, sometimes you better off, particularly word sister, you're better off calming down and listening to them, because they can make your life miserable, and as well as they can make your life very, 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 very good. Jean, if you have something to say.
Yes, nice presentation, guys. You practically cover everything. What you just mentioned, the relationship with the nurses, I think it is the key, especially for the junior doctors.
Very important.
If you have a bad relationship with the nurses, you're done. You can learn a lot from the nurses, and they will cover you if necessary. If you're kind to them, I was very lucky. I had an elderly from Nigeria. He knew that I was just graduating and I was going to start working. He was not in the medical profession at all. And he invited me to his place one day and he told me the following thing. He said, when you will start working in the hospital, make sure that all the nurses, I don't know why he said that to me, that they like you. I didn't understand what he meant. Said sometimes buy a little present, take it to them. Just make them feel comfortable. And I followed the advice of this man. I will tell you something. When you are a junior doctor, I don't know about you guys, and you start working, you don't know much. You may have a degree of a doctor, but when you start, most of the things, especially if it's a specialty, you've never been there before, you will need the support of these nurses. They will tell you the tricks. They will tell you about the consultants, what you should be avoiding, how you should be preparing yourself for the presentation in the morning. The nurses, they know all of this stuff. So as a junior doctor, that was a very, very good advice for me. And I've learned the basics of clinical orthopedics through the nurses, the matron. So just for this part, you cover everything as I said before, but there was one point I wanted to emphasize a little bit. The patients, sometimes they feel like they've not been listened to. When you're a junior doctor, most of the time you're under the pressure. And when you come even to take the history from the patient, it's like you wanted them to tell you certain specific things and you didn't care about the rest. And the patient feels like they're not being listened to. You can spend even half an hour or even an hour, and in the end of the day, they will say, I've not been listened to. So I started to apply this tactic. When I have a patient, I let them talk. At least for 2-3 minutes, they talk until they expect me to start asking them a question. You will find out a lot of things and you'll be able to get exactly to the point where you want to go.
Yeah.
And in the end of the day, they are satisfied and they will consider you like a very good doctor. I didn't know this for a very, very long time. I had many complaints and I was wondering, but why is this patient? I've been so kind to them. I've done everything. And you will see most of the time they were complaining like I was not listened to. So it is something else to ask questions to the patient, and it is something else to listen to what they have to say. Even sometimes it might be irrelevant to the to the problem they are having. Just listen, and that will make them feel like a person. As you said before, they will feel they've been listened to, and somehow you break some barriers, and you will see every time they will be prompt to cooperate when you need them. So that's what I wanted to say.
Well, thank you so much. That's very true. Any other comment?
That's called the golden minute. Us GPs, quiet, are you about to say the same thing?
Yes, I was just going to say
it's the golden minute. Yes.
It's the golden minute where you
the
just
golden minute.
What are you here for? And they talk.
Yes.
And you just listen.
Yes.
And I have to tell with my consultant, mostly my surgeon friends, that we get complaint. I just went in and I was out in a second. That's what they say. I know that's not what actually happened, but that's how they perceive what has happened. So is it true? And I'm afraid that's what we get.
I remember
he didn't do anything. I
got fobbed off. I got fobbed off.
And then he just said, okay. Yeah.
When I used to work in the hospital, I had this surgeon and this respiratory physician that didn't see eye to eye. When they when they said there's going to go around with the junior, are you writing too much? You say, why writing too much? Are you a physician? then when the physician picks an ECG and give it to read, he will say, I'm sure anybody can read this, even the surgeons. So,
It was a lovely talk, guys. I need to go.
no, thanks for coming
Goodbye,
up.
Masambula.
Thanks.
Lovely
Now,
talk.
with 19 past, anybody has some questions or comments? So anecdote. I'll say one thing which I wish I also knew when I was a junior was to get a mentor early on in my career. Not a coach, a mentor, somebody who I could bounce ideas with. And,
That's very, very, very important.
Very, very important, yeah. So I want to encourage the juniors who are starting their careers to identify mentor or mentors.
Yeah. Ines has a hand up. Yeah, sorry.
I find out that people who you get a mentor of any race, but also getting a mentor of the black race is important, because the things that we go through, the daily lived experience, if you're not a black person, you will not understand it. You might also see in the news one of the few times, but to be able to live with it every single day and learn how to handle it in your stride without it affecting you. So yeah, that's something which it's always good to consider, getting identifying a mentor.
Ines' hand is up, Uncle Val.
Ines, Ines, you can speak.
Yes. Hello, good evening again, and thank you very much to all the speakers for the presentations. They have been very insightful. I have two questions. The first one is to know, in your daily practice, how do you keep updated with the legal aspect of the medical practice? Because I guess here in the UK, it's not like in Cameroon, where in terms of law, things are not really well followed in Cameroon. So here, how do you stay updated? Do you have like a code of conduct that you need to read on a frequent basis, or are there conferences, seminars, so that you will not forget anything during your practice? The second question, I am currently studying public health, so I am trying to find opportunities to volunteer or finding internships or part-time jobs. So I would like to know, in the NHS, for example, are there opportunities to do so? And if yes, how should I proceed? Thank you.
Right, let's start with the first question. Thanks so much, Ines. That was the very, very nice questions. Let's start with the first questions. How do you keep up to date with the medical legal aspect of your practice? Let's start with Dr. Bello.
Yes. Yeah, that's a very interesting question, because I guess I don't really go to work thinking, how am I keeping up to date medical legally? I think if I'm doing all the things I'm supposed to do, which I've kept up to date with my work, if I don't know something, I'm asking. If I'm doing my job well, then I expect that I'm not going to get a complaint. But the thing is, we'll still get complaints here, even when you've not done anything wrong. It might have just been a patient that you've seen, that you were involved in the care, and they weren't happy with something. You might not have done anything wrong at all. So how do we go and do our jobs? We all have indemnity, so we're all indemnified, and all of us, and you're not allowed to work without an indemnity. So, and if someone comes in and says, Dr. Bello said A when I said B, we just leave it to the indemnity to sort out if it's a serious complaint. If it's a complaint that is just a one-page letter, it gets sorted out at the low level in the surgery. So that's how, we just, most of us, we work, we have a duty of candor, we're honest, we follow guidelines. You work according to guidelines. You only get into trouble if you decide to become rogue. You decide to prescribe medication you're not supposed to prescribe, or things like that. So that's how you stay. It's not like Cameroon where you can just do whatever you like. You follow clear guidelines, and if you don't follow those guidelines, eventually you make a mistake, you get caught, and that's how it happens. So we work according to the guidelines, and we all keep up to date with. So for us GPs, every year we have our GP update. You go and you find out what's the latest things that you need to do. And even if you've not been on an update course, there are some websites for us GPs. There's one called 9CKS. You just go on there. If you don't think that you're using the most up-to-date thing, you just go and you check. And that's where you say to the patient, I say to the patients a lot of times, I'm just going to check the up-to-date guidance on this and just make sure I'm managing you well. So that's how I do it.
So,
All right. Thank you very much.
can I just add one thing to
Yeah.
that? Ines, if you actually want a framework which you can just read, then the GMC is Good Medical Practice is probably the best one to read. I mean, a lot of it is common sense, and it's
Yeah.
very much what Linda just said. You know, you just do your job correctly and be honest, and you're covered basically. That will cover all of that. But good if you read the Good Medical Practice, that will cover all of this for you.
Okay, thank you.
Yeah, John, if you had your hand up.
Yes. Can you hear me?
Yeah.
I turned on my microphone. Okay. Yes. Just another thing. We might not have mentioned it. I just heard our sister that is coming from Cameroon. For those who work here, they know that in this country, what was not written didn't take place. So if you didn't write the notes, it doesn't matter if you did it or not, it didn't happen. So I work in other countries here in Europe, and they don't pay so much attention on the notes. It's unbelievable, but in Europe, there are countries where you can do your whole clinical action without taking notes and nobody will bother you about it. But here in the UK, you have to pay a lot of attention. Whatever you do, write it down. If something feels not okay, write it down. And this is the way you cover your back. And of course, in most departments, you've got protocols. Sometimes they're even written and they're put on a board somewhere. So if you're not really sure about it, you can ask and then they will tell you. And of course, there is a nice guideline for those who are interested to go and read. Just that.
But your hand is up.
Yeah, hi. Hello, everyone. I was listening on YouTube, and then it came to this stimulating bit about relationships with advice and things like that. Then I had to now rush back onto the Zoom because I was trying to multitask. Is good, really wonderful advice. I'll go back. Maybe I just start with who was the one? Was it Ines who was asking about medical legal things?
Yeah.
Yes.
Yeah. So I mean, the basis, as Linda said, is that when you keep up to date and you do your clinical practice to the best of your ability and to what the recommendations and guidelines are, you generally are safe. It is also to work in this country, you're required to have a medical defense things. They also do provide a lot of guidance on common issues and mistakes. So if you're registered with a medical defense organization, which we all have to do, when you go onto their websites, even some of them are free, actually, you don't even have to be a member. They tend to give advice on very common, they discuss common things that people tend to make mistakes about. And you all alluded to about being the duty of candor. You have to be honest. Do not, most people, we fall foul in trying to, you think it's some minor dishonest, some little lie. And in trying to rectify that lie, you then get yourself into serious problems. And that's where your credibility is lost. And GMC, it becomes a very big problem. Once you've lost the trust and things like that, then you're into serious problems.
Probity issues.
Yes. So I started with the first one. Going back, the one about nurses and how that nurses are absolutely the people, your nurses or midwives, whoever they are, they're the real people who are teachers. My mom, who was a nurse midwife, told me that from medical school, right? They are very important. It's from them you learn the ropes. You also have a good rapport. Means I don't know whether nowadays people do this kind of 24 hours on call, but when you're on night duty, when you have to go sleep, they will be the ones who can tell you, group all the work for the patients, and you come in and you do everything. They call, they bleep you, you come in and they go through all the charts and you do the work. If your relationship is not good, they just do one at a time. You sign that medication, you go to your bed, they ring you for the next patient who was next door, and you can find yourself just doing that to and fro. They're the ones who will check what you've written. You may have said, you may have written, 375 milligrams of amoxicillin. It's an error. Maybe you were thinking of co-amoxiclav, but you've done it. And they may correct you. They'll tell you those sort of things. If you're not a good guy, probably they just leave it, and that becomes an incident form or whatever it is, a datax and stuff like that. So they can make your life miserable. Just to confirm that. Talking about patients and how listening to patients, I'll tell you another technique which we learned, which somebody taught us, is that when you are talking, you're going to a patient, and whether you're clerking them or you're just there to listen to them, and you stand there, there are 20 other people or maybe 15 other people you got through, and you talk. And as usual, the complaint will be you're not being listened to, or you're not listening to them. The technique someone told us, a senior clinician, is that go to that bed, get the chair, sit down. You sit down and you talk to them, or you listen to them for 5 minutes. You know that thing that the Minister of Education did, where whatever was, those 5 minutes will become, for them, it's like 30 minutes. Because you sat down, you didn't give the impression that you're in a hurry.
No.
However you are, you may be pressed with time, but you just take time. You now go down to the level which eye to eye. It gives a very different psychological impression. So that's a little other trick. The last one was to do about knowing patients, that old patient, the old elderly person, you are there dealing with them, and knowing what they did or how they've done, and humanizing them and relating. I have been privileged. I worked for quite a few years in a very, very privileged hospital, King Edward VII Hospital, which used to deal with, it still does. I mean, it deals with establishment in this country. And you met all sorts of people from royalty to the common person, the soldiers and stuff like that, officers, and even private patients. I had a lady who was in the room, quiet, very quiet, came and saw her. I was very polite and everything. And you could just see she was just going about her little things. And then one time, so I just sort of asked about her, just took the time to say, look, hello, how are you? What were you doing? And you know what that lady was? This was an elderly lady. This was the first female pilot in this UK. They were the first pilot, with license to fly. And she used to fly planes from the factory during the Second World War when they made them, fly them, take these planes to the front to where the fighter pilots would be doing. And there she was, just calm with a little dignity, just like that. And she had stories. And that's how lots of people, you sometimes met some of generals or people who had decided how the war went, and they're frail and stuff like that. So it was just to, those were the points. I just thought I should just come in and talk, and it's really been wonderful listening to you all, and I hope that helps.
Well, thank you so much, because that was very interesting. Yeah, you're right. It's and I think I'm gonna start using Johnny's thing now, proactively asking for those pictures. But it's very true. Kind of the patients is the kind of patients I see when you try to find out what they've been, and it's quite exciting story. I found out a few days ago one of my patients was actually the Olympic boxing champion in the 1955, I think. He was an Olympic boxing champion. So he was a bit confused on the word. And I said to my nurses, if it takes you one-on-one now, you'll be shocked what he will do to you. Now, Ines had a second question. And that second question was about part-time work, wasn't it, Ines? Is she still on? How does she get part-time work? Can you clarify
Yes.
that question for us? Just,
Okay, thank you. I wanted to know about how should I proceed in order to find either part-time jobs or internships or even to volunteer, for example, with the NHS or other bodies, especially in the field of public health or research.
right. Okay. And can anybody answer that question? The volunteer or part-time work in the field of public health. Yeah, because one thing you will notice public health medicine in the UK is, I think Emma would have been a better person to answer that question, wasn't it?
Public health.
UK,
Public health. It's outside of it's outside of acute care. So
yeah,
I don't know. Is there
okay.
any? There used to be someone, but he left. I think he went back to Cameroon. That was in public health. But Emma might know, so we can ask and find out.
So there's one of our consultants with infectious disease, because infectious disease in the UK, they do sometimes they go into the public health arena as well. So we're going to ask Dr. Sutebo to give us an advice on that and see if they can give any link people in public health that they can link you together.
Okay, thank you, Dr. Thank you very much.
Not to worry. So yes, we'll find out from Emma. Because as you get to know, public health rotation is out of acute care trust. So you need to know somebody who is there. But Emma, I think when Emma was doing his rotation, he used to go do some public health, so he knows some people. So we're going to ask for advice from him.
Linda, I wonder whether our good friend Pam could be of help.
Okay.
Yeah, Pam is with Public Health England.
Yes, we could ask. Yes.
Okay,
yeah, we could also ask her.
Yeah.
Mm-hmm.
That's good. So just leave it with us. We'll try and get some answers for you.
Okay, thank you very much.
Not to worry. Any other comment or question? So
yeah. Can I ask a question?
Yeah, sure.
Yeah, so this is like a concern which I've experienced for the first couple of months I've been working here. So I kind of get it quite often. My patients complain to me that sometimes they can't hear what I'm saying, or they can't maybe follow, and not just the patients, and even some of my white colleagues. So I have to repeat myself sometimes. So I just want to find out if any of us experienced that and how.
Oh yeah, I did a lot.
Yeah, how did they?
Because I speak very fast, so this is a struggle. People struggle to understand me. Like when I was tense, I speak very fast. It's how do I put it now? For me, how I would talk here is not the way I would talk when I'm on the ward. Though sometimes I still go very fast, but it's making that conscious effort to be understood. So what I used to do is when I'm speaking to patients, intermittently I check understanding. Intermittently I'll check understanding. And then I'm also seeing whether they're nodding. When they're not understanding me, there's a way they'll have an expression on their face. It's like, I don't know what you say, then I'll repeat it again more slowly. You will find that as you are consciously making that effort to speak that they understand you, your accent changes invariably and you become better at it. So communication skills is something in which you will learn a lot of it. There'll be simulations, there'll be many things. If there's one thing I would suggest you start applying it into your career now, is taking communication as important as anything. And so there are two things you don't want them to say, to think you're not good at: communication and safety. So there are many courses you can attend. I'm sure your talk can arrange that for you. There are many courses you can attend for communication skills as well. And then, of course, you have to make. I remember back in the days when we were going for PACEs, we used to get up in the night and practice how to present in front of the mirror, or you record it on your computer and then play it back to yourself. There has to be a lot of conscious effort put inside. And anyone wants to add something to that question on communication? Well, let's not ask.
Yeah, I think that's invariably happened to every single one of us. In terms of, the pattern and stuff like that. I mean, and it's also the flip side. My first job, when I first came to the UK, my first job was a locum job in Dumfries and Galloway in Scotland. And that was fascinating because the accents are quite heavy. And there are slangs and words that they would use. And the only way I would understand is by the direction of the conversation. So it can be tricky, but that gets better with time. But as Vali said, you need to go slow and check for understanding. And then it just gets better over time. But really go slow and make sure that whoever you're talking to is understanding you as you go along. And if they don't, then you sort that out and then you move on to the next bit. I think just be reassured that we've all been there and it gets easier.
Yeah.
For sure.
All right, thank you.
So just to add to that, Rekna, it's probably worthwhile, like Vali said, he recognized the reason why people might not understand him is because he speaks fast.
Yeah.
And presumably, Vali, you made a conscious effort to slow down, when you're doing a consultation, to slow down how you're speaking. And I think, so if you're able to work out, which aspect it is of your speech, which makes people, or, which means people don't understand you. And in most cases, it is because we speak fast. Then just consciously, you're taking that breath and then trying to remember to speak slowly. It's like, if you're giving a lecture, that's one of those scenarios where, like Vali said, I will time myself how long it would take, and I'll go to give the lecture, and I'll take like 2/3 of that time and finish because I'm nervous. I'm standing in front of a big crowd.
Yeah.
I'll just like speak. But the longer I've been doing it now, I know that I need to pace myself from beginning to end. I mean, obviously it's different now because I know what I'm talking about. I've got more confidence, but it's the same thing. I think if you just sort of keep trying to make that conscious effort to be slower when you're talking and actually keep reminding yourself, slow down, slow down.
All right, thank you.
Good. Any other comment? No? Right. I think we've done 1 hour 43 minutes. Has been brilliant. I'm so grateful for Linda, Johnny, Osric, Jean-Yves, Kojo. I'm so grateful for all the Inquire Masabula for your advices and discussions. I think this is very enriching. Thankful for all the doctors who've turned up and be part of this conversation. And I'm sure as we go on, we'll be finding out conversations like this, which are very enriching to our careers. The idea, as I keep saying to the younger ones, whether you like it or not, you'll be condemned to become better than us. That's their condemnation. So, because that's the only way we can prove that life is progressing. And so, so you have to. And so everything that we've done that we couldn't do better, we'll pass it that over. So you do it better and you become better. And that's how we build the community. I also want to emphasize, we cannot build a community without giving something into that community. If it's your time, whatever it is, we have to build. So our CamdocUK is our community. And many of these senior guys that you've seen here today, they've given their time because they believe in us building our community. So let's try and join that part of building this community together. And without much ado, it's right for me to say thank you to everyone present here, and good night.